pupillae muscle. The infratrochlear nerve, nervus infratrochlearis, is given off from the nasociliary just before it enters the anterior ethmoidal foramen. It runs forward along the upper border of the rectus medialis and is joined, near the pulley of the obliquus superior, by a filament from the supratrochlear nerve. It then passes to the medial angle of the eye and supplies the skin of the eyelids and side of the nose, the conjunctiva, lacrimal sac, and caruncula lacrimalis. The ethmoidal branches, nervus ethmoidalis, supply the ethmoidal cells. The posterior branch leaves the orbital cavity through the posterior ethmoidal foramen and gives some filaments to the sphenoidal sinus. The ciliary ganglion, ophthalmic or lenticular ganglion. The ciliary ganglion is a small sympathetic ganglion of a reddish-grey colour and about the size of a pin's head. It is situated at the back part of the orbit, in some loose fat between the optic nerve and the rectus lateralis muscle, lying generally on the lateral side of the ophthalmic artery. Its roots are 3 in number, and enter its posterior border. 1, the long or sensory root, is derived from the nasociliary nerve, and joins its postero-superior angle. The second, the short or motor root, is a thick nerve, occasionally divided into 2 parts, derived from the branch of the oculomotor nerve to the obliquus inferior, and connected with the postero-inferior angle of the ganglion. The motor root is supposed to contain sympathetic efferent fibres, preganglionic fibres, from the nucleus of the third nerve in the midbrain to the ciliary ganglion, where they form synapses with neurons whose fibres, postganglionic, pass to the ciliary muscle and to the sphincter muscle of the pupil. The third, the sympathetic root, is a slender filament from the cavernous plexus of the sympathetic. It is frequently blended with the long root. According to Tiedemann, the ciliary ganglion receives a twig of communication from the sphenopalatine ganglion. Its branches are the short ciliary nerves. These are delicate filaments, from 6 to 10 in number, which arise from the forepart of the ganglion in 2 bundles connected with its superior and inferior angles. The lower border is the larger. They run forward with the ciliary arteries in a wavy course, one set above and the other below the optic nerve, and are accompanied by the long ciliary nerves from the nasociliary. They pierce the sclera at the back part of the bulb of the eye, pass forward in delicate grooves on the inner surface of the sclera, and are distributed to the ciliaris muscle, iris, and cornea. Tiedemann has described a small branch as penetrating the optic nerve with the arteria centralis retinae. The maxillary nerve, nervus maxillaris, superior maxillary nerve, or second division of the trigeminal, is a sensory nerve. It is intermediate, both in position and size, between the ophthalmic and the mandibular. It begins at the middle of the semilunar ganglion as a flattened plexiform band, and, passing horizontally forward, it leaves the skull through the foramen rotundum, where it becomes more cylindrical in form and firmer in texture. It then crosses the pterygopalatine fossa, inclines lateralward on the back of the maxilla, and enters the orbit through the inferior orbital fissure. It traverses the infraorbital groove and canal in the floor of the orbit, and appears upon the face at the infraorbital foramen. At its termination, the nerve lies beneath the quadratus labii superioris, and divides into a leash of branches which spread out upon the side of the nose, the lower eyelid, and the upper lip, joining with filaments of the facial nerve. Branches. Its branches may be divided into 4 groups, according as they are given off in the cranium, in the pterygopalatine fossa, in the infraorbital canal, or on the face. In the cranium, middle meningeal. In the pterygopalatine fossa, zygomatic, sphenopalatine, posterior superior alveolar. In the infraorbital canal, anterior superior alveolar, middle superior alveolar. On the face, inferior palpebral, external nasal, superior labial. The middle meningeal nerve, nervus meningeus medius, meningeal or dural branch, is given off from the maxillary nerve directly after its origin from the semilunar ganglion. It accompanies the middle meningeal artery and supplies the dura mater. The zygomatic nerve, nervus zygomaticus, temporomalar nerve, orbital nerve, arises in the pterygopalatine fossa, enters the orbit by the inferior orbital fissure, and divides at the back of the cavity into 2 branches, zygomatico-temporal and zygomatico-facial. The zygomatico-temporal branch ramus zygomatico-temporalis, temporal branch, runs along the lateral wall of the orbit in a groove in the zygomatic bone, receives a branch of communication from the lacrimal, and, passing through a foramen in the zygomatic bone, enters the temporal fossa. It ascends between the bone and the substance of the temporalis muscle, pierces the temporal fascia about 2.5 cm above the zygomatic arch, and is distributed to the skin on the side of the forehead, and communicates with the facial nerve and with the auriculate ulotemporal branch of the mandibular nerve. As it pierces the temporal fascia, it gives off a slender twig, which runs between the two layers of the fascia to the lateral angle of the orbit. The zygomatico-facial branch, ramus zygomatico-facialis, malar branch, passes along the inferolateral angle of the orbit, emerges upon the face through a foramen in the zygomatic bone, and, perforating the orbicularis oculi, supplies the skin on the prominence of the cheek. It joins with the facial nerve and with the inferior palpebral branches of the maxillary. The sphenopalatine branches, nervus sphenopalatini, 2 in number, descend to the sphenopalatine ganglion. The posterior superior alveolar branches, ramae alveolares superiores posteriores, posterior superior dental branches, arise from the trunk of the nerve just before it enters the infraorbital groove. They are generally 2 in number, but sometimes arise by a single trunk. They descend on the tuberosity of the maxilla and giving off several twigs to the gums and neighbouring parts of the mucous membrane of the cheek. They then enter the posterior alveolar canals on the infratemporal surface of the maxilla, and, passing from behind forward in the substance of the bone, communicate with the middle superior alveolar nerve, and give off branches to the lining membrane of the maxillary sinus and 3 twigs to each molar tooth. The twigs enter the foramina at the apices of the roots of the teeth. The middle superior alveolar branch, ramus alveolaris superior medius, middle superior dental branch, is given off from the nerve in the posterior part of the infraorbital canal, and runs downward and forward in a canal in the lateral wall of the maxillary sinus to supply the 2 premolar teeth. It forms the superior dental plexus with the anterior and posterior superior alveolar branches. The anterior superior alveolar branch, ramus alveolaris superior anteriores, anterior superior dental branch, of considerable size, is given off from the nerve just before its exit from the infraorbital foramen. It descends in a canal in the anterior wall of the maxillary sinus, and divides into branches which supply the incisor and canine teeth. It communicates with the middle superior alveolar branch, and gives off a nasal branch, which passes through a minute canal in the lateral wall of the inferior meatus, and supplies the mucous membrane of the anterior part of the inferior meatus and the floor of the nasal cavity, communicating with the nasal branches from the sphenopalatine ganglion. The inferior palpebral branches, ramae palpebrales inferiores, palpebral branches, ascend behind the orbicularis oculi. They supply the skin and conjunctiva of the lower eyelid, joining at the lateral angle of the orbit with the facial and zygomatico-facial nerves. The external nasal branches, ramae nasalis externi, supply the skin of the side of the nose and of the septum mobili nisi, and join with the terminal twigs of the nasociliary nerve. The superior labial branches, ramae labiales superiores, labial branches, the largest and most numerous, descend behind the quadratus labii superioris, and are distributed to the skin of the upper lip, the mucous membrane of the mouth, and labial glands. They are joined immediately beneath the orbit by filaments from the facial nerve, forming with them the infraorbital plexus. Sphenopalatine ganglion, ganglion of Meckel. The sphenopalatine ganglion, the largest of the sympathetic ganglia associated with the branches of the trigeminal nerve, is deeply placed in the pterygopalatine fossa, close to the sphenopalatine foramen. It is triangular or heart-shaped, of a reddish-grey colour, and is situated just below the maxillary nerve as it crosses the fossa. It receives a sensory, a motor, and a sympathetic root. Its sensory root is derived from 2 sphenopalatine branches of the maxillary nerve. Their fibres, for the most part, pass directly into the palatine nerves. A few, however, enter the ganglion constituting its sensory root. Its motor root is probably derived from the nervus intermedius through the greater superficial petrosal nerve, and is supposed to consist in part of the sympathetic efferent preganglionic fibres